about that. I just want to call.
No worries.
Ready to get this day started?
Absolutely, let's go.
Clinic day where we do all our consults, follow-ups, micro procedures, take our photos before and afters. It's always pretty hectic. If you want to ride with us.
We don't want anybody to know that.
Rose, so what's my schedule today?
Today you have a scar revision, we have pre-ops, we have follow-ups, and we also have some new consults today.
Okay, perfect. All right, I'm just tidying it up because we get behind up here. And then, oh yeah, look at this. Little lip plumper. It's basically like plumps your lips. It's like a filler for like 2 hours before dinner. It says Dr. Andrew.
Thanks so much.
You're welcome. Benefits of plastic surgery, you get a lot of free stuff.
Hey, so why do you have all those lace bras behind you?
Yeah, you go.
Oh, I'm already recording.
So, reason why we have this, so after girls get breast augmentations, my wife buys them like really like fun bras so that they feel good about themselves, and then it also helps us get some before and afters, and that way that we can do that. And right now what we're doing is we're waiting for them to set up for our procedure, so once that's ready they'll give me a call and we'll get set up for that.
Perfect.
Today what we're doing is we do a lot of in-office procedures, and belly buttons are one of my specialties, so I'm definitely, people come to get touch-ups on belly buttons and everything. So today we're just going to excise a little bit of the belly button skin to get it to dive in a little deeper, and we're gonna also try to make these scars on the ends a little bit thinner. What we do is we're gonna use this to numb her up, just lidocaine with epinephrine. So we inject all these spots. We wait about 15 minutes, get you fully numb, and you're not gonna feel anything, okay? Just the prick of this. Once you're fully numb, we'll get you all cleaned up and we'll drape you, and then we'll make the incisions. We'll put the stitches in. We'll see you in 2 weeks to get the stitches out. Kind of baby it, no oceans, pools, or jacuzzis for about 2 weeks, and we'll give you pain meds and antibiotics just in case, all right?
Thank you.
All right, we'll get started. Like a permanent marking pen that we always use. So I'm gonna make my marks here, and we use this special pen because once you have saline and lidocaine, you don't lose your marks. So it takes a while to get off. So the belly button one, I don't need to touch really here. So just down here. Other side. Belly button. Post-op, the drains are less than 25 cc's, and we're going to remove those drains today. So this is what the drain colors look like. They're watery, less than 25 cc's. I'm going to take a look in here. Oh yeah, you're perfect. So good. That's definitely
normal?
that's
Like
definitely,
it's like,
yeah. So you're only 7 days out. You're going to have swelling. That's what the compression is going to do. The compression is going to be your best friend.
okay.
Obviously, people like to do massages. That's also helpful.
I can do that?
You can. Massages are helpful, but the most important thing is compression. And this swelling is definitely normal. Breasts look perfect. They look bruised, but really good. And remember, you had that little thing that's gone.
It looks like it's fine.
It's gone. So hold these real quick. Okay, I'm gonna get the scissors out. Removing drains is not going to be painful. Okay, but it definitely makes people nervous. So we'll get this out. So when we remove them, we remove the suction, so you don't feel the suction. We're gonna cut this off. We're gonna remove this suction. Cut this off. All right, underneath here is our thread that locks in the drain that we're just removing. Rose, can I get some gauze, please? Where we remove the drains, it's gonna drip for about 3 days.
Okay.
All right. Well, this is what the drains look like. That's coming out. I'm gonna take a look at your belly button. Looks perfect. That's that signature belly button. It looks great. So what happens next is Miss Rose is going to put you in our faja. Okay. Make sure it doesn't dig into her incision. Next week we're going to remove all the stitches.
Okay.
Okay. Swelling is normal. 6 weeks for the swelling to come down. For 2 full weeks, you're only 1 week out, but for 2 full weeks, you really still gotta take it kind of easy.
Okay.
After 2 weeks, we'll kind of talk about how to get back into it.
Okay.
Compression, and then if you have that lipofoam,
Yeah.
use that lipofoam where you feel the most swelling.
Okay.
All right, doing
So
great.
still nothing, no, stay on my med.
Things. Here it is. So that's that. Right now, we're about to do our minor procedure, so I have to come over here and get the sutures I want. So they usually leave them out for me because I want to get the sutures.
What's a what's the word?
Suture.
Suture? What's
Yeah,
a
so come
suture?
over here. So if you look at this cabinet, these are basically strings, but we use the word suture for whatever reason. But so there's different types of suture or strings. Like these are going to absorb fast. These are going to last a little longer. So, during training, you know exactly what suture to use in different spots. And that's just what I'm collecting now. Sometimes the girls will have this ready for me, but when they're not sure, they just say, go grab whatever you need. So that's what we're doing now, and I'm gonna go get it started, and then we'll show you the procedure. We would be Thursday, and now it's today, is that correct?
So what exactly are we doing here?
So in her belly button, there's a little bit of excess skin left from her original belly button. And so we're just reducing that so that we're not overdoing it, just to tidy it up, makes it a little bit more sunk in, a little bit more attractive. Just a little touch up. I think the belly button looks great, but we're here to make it as great as possible, and that's what we're doing today. So we're totally under lidocaine. She can't feel anything, and she does, we can always add more. She's fully awake, she's comfortable. You always have music in the background. As a surgeon, you grew up as a resident always listening to music while you do anything, so.
I can tell we're in Texas.
Yeah, we got country today. Some days is EDM, Kygo, just kind of.
Depends on your mood.
Yeah, I'm in a soothing mood today. If I'm feeling tired, I'll put Kygo on just to give me some energy boost. Yeah, so I'm cutting this old scar out using a knife. She's already been prepped, so she's clean. Talking about suture or string. Now we're using that suture to close the incision, and this suture will last for about a week, but this is how we close the wound. So once we cut out exactly what we want, we're going to close it with this suture, and then I'll see her in about 2 weeks just to remove anything. And that's it with the suture. You need that? Everything went perfect. I'm just gonna clean her up, and then you can zoom in. We'll get it cleaned up, but look how beautiful that is. Beautiful, beautiful dog. Okay. All right.
I think I have a little stitch somewhere here.
Oh yeah, you definitely do. Wait, is that a spinning stitch?
I feel it somewhere.
Wait, is it this right here?
No, not that one. I can feel it somewhere. It's weird. I just felt it and then now I can't feel it.
So, if it's buried underneath the skin, it's hard to grab it, but the spinning stitch will poke through, and if it does poke through, you just text me, and I'll help you come in, I'll grab it and remove it.
Okay.
We're gonna take some photos today, all that stuff for Instagram. Your result's perfect. It's
Okay.
so good. Okay? All right. Yes. No, just her old photos. So we're a couple of months out. I just want to go over a few things. The breast Really great shape. Scars are hidden here, and you can see over time this line really fades nicely. Just love this appearance of her breast. On her abdomen, you got these swimsuit lines, signature belly button, looks great. Scars are low, really beautiful, looks great and comfortable. I'm gonna close this real quick, and I wanna just kind of show this arm. You can see how nice this arm is, and I have this right here to kind of compare. We used to have I just want to compare. You can see that we used to have much more of a hanging drape right there, and now we have a straight line, really great. And you can also see the other side here, just beautiful. So really excited for her, and I'll see her in a few months. That's great. You look beautiful. I'm gonna get some injections a little bit too for the help with some of that scar.
Okay, thank you.
Another garment to be compressed.
Yeah, just always be compressed.
Siempre trae la faja puesta.
Siempre, pero o sea, puedo ponerme, por lo menos en el trabajo usamos una faja
Two
lumbar.
fajas on.
Aquí,
Ah.
que
It's not too tough. Just a nice hug, comfortable, and then that's all.
Algo
But
cómodo.
mostly just take it easy.
Okay.
Alright. Okay, so we are 4 weeks out from a tummy tuck, male, which is great, which love to take care of these massive weight loss, done a good job of losing weight, so we always keep some sutures on the tail that we're gonna remove today. Cool, little snip. Right here, this is what it looks like. Throw it in the trash. Usually one that's on both sides. This one popped off. And we have this like tape that we put on the incision, which we're not showing right now, but we're gonna slowly peel it off for him. I'll show you that tape. There's that tape coming off. So he's doing a great job with compression. The belly button looks great. Just continue compression. You look great. Scar. You want to look. Tell Rose, tell him to look down at the scar.
Si quieres
Look how
ver la
fine-
cicatriz,
If you can see how. Do you see?
¿se
Can
te
you
ve
see it?
bien?
Here, let me give you this.
¿Todo bien?
Oh,
Very good.
Fenomenal, ¿verdad?
Okay, I'll see you in 3 weeks. Okay.
Te vemos.
Let's see. If I can't get anything today, we'll let it come out a little bit more, and then I'll see you back.
Also, it's like an internal thing.
It's like a stitch that just wants to come out.
I don't feel anything.
Good. This one.
Does that have anything to do with the belly leaking? I know.
No. Is it leaking deep or shallow?
Like I'll put some gauze in there or something, and then it'll be like mucus or something. I don't know what it is. Blood. I don't know.
I'll just take a. I think what you really need to do is get like a Q-tip like this, get some soap and water, and get really deep in here, and just kind of clean it. See, it just needs to be clean. That's the thing. It's like sometimes your belly button can be deep, and so when it, you got some junk in here, so you just have to really get in there. That's
So
all.
it's just
It's
I'm
nothing.
scared to go in there.
I know, but nothing to be afraid of. That's really what you're seeing in there. So
Okay.
it's nothing. You're fine.
Like once a day thing or?
Every time she's in the shower, maybe put some Q-tips
Okay.
on the. Yeah.
So what does she mean a stitch is kind of coming out?
So we have like hundreds of sutures or stitches or threads. It's like a word that is interchangeable, all underneath the skin, and they're all dissolvable for the most part. And sometimes when that stitch is very close to the skin, the body can't degrade that suture fast enough. And so the body pushes it through the skin, and the easiest thing is to remove that stitch so that the body can heal over it. But we put those stitches very close to the edge, so that's why sometimes they call it like they're spitting. So we just take them out. But if we did nothing, they would still absorb, but they kind of would annoy and bother the patients.
Is it painless to take them out?
If it's right there, it's painless, but if I have to dig a little bit, there's always a little ouch effect.
Okay. We'll see.
A couple months.
Couple months.
Whenever she wants. She's free.
She's fine.
Yeah.
The instructions from the hospital were like, don't do anything for 6 weeks. I know you told me no sexual activities, for 6 weeks. So,
Right.
so my question is, I'm going out of town with my husband.
Right. You have 4 weeks, right?
Yeah, so it's okay for me to travel. We're going to Mexico.
Right.
I mean, I'm not going to be at the beach.
Right.
We're going to go to just a nice city in Merida. It's
Just the overhead
walking.
luggage. Make sure your husband does all that.
Oh yeah, he's gonna do all that.
You
I
just-
do have a toddler. Like they don't. You know, I'm being careful regardless. You know, I do have a toddler, so I have to carry him like. You know.
Just lifting the toddler to your chest is not ideal. So just be mindful. That's all. I know things happen, so you can't control it, but that's that.
And you know, my husband is out of town this week, so I have to put him to sleep, in bed too in the crib. So it's.
Everything's perfect. Implants are soft. For 3 weeks or.
Tomorrow will be 4 weeks.
Sutures are out. Leave that. You have tape underneath your implant. Leave that tape until it falls off,
Okay.
and then just gently continue your breast massaging.
Oh, I haven't done massages.
Right, I know because
Okay.
of the type of surgery, but just do a
Okay.
gentle breast massage.
Okay. So I know you know.
So this is the Let me get the. Sometimes in our clinic, because it's like there's no lighting, we always come out here because it's like
Yeah.
where the lighting is, and just to get like some. What I want to know is why do we still have this Christmas tree?
I'm sorry. I will take it down
I mean,
today.
or
It's pretty though.
in about 11 months it'll be perfect again.
I know. Absolutely. We were thinking just put like hearts on it.
Well, why don't you turn this red and be Valentine's? Right. The holiday tree. But right now, it looks awesome. We have a Christmas
Literally
tree.
February. Gotta
Right.
change it.
Right. Is this sun too much?
It's a little too much. How many cups of coffee do you drink a day?
For sure in the morning, I have 2. And some of those are espresso, some of those are coffees, depending. We got a really
Cream and sugar?
no cream and sugar black.
Is that because you're a doctor and it's bad for you?
No, it's not that it's bad for me. It's just like when you're in residency training, they have that really cheap, disgusting hospital coffee, and you had no time. And like some drawers had cream, some drawers didn't. So there's like no time. So if you were very particular about your coffee, you would never drink coffee, and you needed it in your training. So you just got used to drinking it black, and now you just drink it black. Now,
Gross.
having fun, you know. Put some. No, my wife puts that creamer.
Thought you were gonna say Bailey's. I was like, oh, y'all are having fun.
No, it's whatever you get. She loves that. And then here, I probably will have a minimum of 2 cups
A day?
a day at the office here. So probably I'm talking about 4 to 5 cups of coffee per day before 5 o'clock.
Oh my god.
Right.
Sounds like an
Probably gonna drink
addiction.
more water, stay hydrated. And then I typically, I mean, some days I'll eat lunch, but for the most part, I try to just like skip lunch, just because sometimes it can make you tired. Like after you eat, you get sleepy, and then you have clinic or surgery or whatever. So without eating, I actually stay more at work. As backwards as that sounds for me. And then big dinner with the family is the routine.
Who cooks dinner?
It's probably split. I mean, I don't. My wife's an amazing cook, but I do all the barbecue stuff outside the Traeger. So if it's outside food, it'll probably me. But it's pretty split, you know. Because Dr. Andrew, she operates pretty late too, so you know I have to cook too to get everything, to get the 3 kids fed on a daily.
How's it managing 3 small children while being a whole surgeon?
It's exhausting, but fun. It gives me it's just basically like I'm always tired. You know, you're always tired.
I feel tired for you right now.
But they also give you energy. And I obviously give a lot of credit to, you know, my wife and Dr. Andrew. She does like,
Your wife's a surgeon too?
yeah, of course. You know, that she's,
That's so freaking cool.
we'll let her. It's definitely teamwork to get through everything. Plus each other, plus grandparents and everything. But it's a full village. To
Takes a village, I was about to say.
raise these 3 kids.
How long have you worked here?
I've been working here for 9 months.
9 months. Do you like it?
I do.